It's a real pleasure to join you here this morning, to see the work you're doing, and to meet so many people with great ambitions for the future. And it's very clear that one ambition that we all share is to see disabled people's employment chances hugely improved. Coming here today, I've been reminded why this ambition matters so much. I've been reminded of the skills, talents and energies of disabled people, of their commitment to do a good job, of the contribution they make. People like Matt, a disabled student who got work experience in my local hospital in Trafford, developed his admin and computer skills, and as a result of his hard work and dedication, saved the hospital pharmacy £13,000 in wasted prescription costs. I've been reminded too how much it matters to be earning a wage so you can buy the things that you want, go out with your workmates, have a bit in the bank to save for things that are a bit special. Like Jonathan, a young learning disabled man I know who's recently moved into his own flat and can't wait to be earning so that he'll have a bit more spending money to buy some bits and pieces for his new home and invite his mum round for a meal. That chance to work and earn, that right to work, the dignity of work, goes to the heart of what the Labour Party stands for. Disabled people, as much as anybody, have the right to decent work. It's a matter of disability equality. It's about our wider ambition for disabled people's right to participate fully and equally in all aspects of society. And crucially too, it's about tackling the shocking level of poverty that disabled people face. Disabled people are twice as likely as non-disabled people to be in poverty, and lack of work is a major factor in that experience of poverty. So it's hardly surprising that the report of the Independent Task Force into breaking the link between disability and poverty, commissioned by my predecessor Anne Maguire and Liam Byrne last year, and chaired by Sir Bert Massey, placed improving the employment experience of disabled people as its top recommendation. Of course, not every disabled person can work, and for those who can't, we must ensure that the system of support we put in place ensures dignity for disabled people and is administered fairly and efficiently. But many disabled people who aren't working could work. Very many would like to work. And yet, as you know all too well, the rate of participation of disabled people in the labour market is woefully poor. Today, the gap between the employment rate of disabled and non-disabled people stands at around 30%. For a while, under Labour, the gap was closing, but under the coalition, it has stalled. Policies to increase the employment rate of disabled people are having little to no effect. The work programme has been an abysmal failure for disabled people, getting only around 1 in 20 into employment. The number of disability employment advisors and job centres has fallen by nearly 100, 20% since 2010. Despite warm words from ministers, access to work seems to be getting harder, not easier to get, helping fewer people now than it was in 2010. Remploy factories have been closed, with almost half the former disabled workforce remaining out of employment. And the work capability assessment process is in chaos, with a backlog of almost 700,000 cases, reassessments put on ice, and provider Atos having walked away from the contract, while the number of people on out-of-work disability benefits is on the rise. In 2014-15, 500,000 more people are claiming sickness and incapacity benefits than the government had planned in 2010. The government are now set to spend over £8 billion more than they planned on ESA over the course of this Parliament, piling up costs for the taxpayer, while disabled people are being disgracefully let down. It's one more sign of ministers' failure to realise that the only fair and effective way to control social security spending is to tackle the root causes of rising spending in an economy that doesn't work for working people, including the thousands of disabled people who want to and should have a right to work. Labour will not tolerate that situation, and we're determined to act. That's why, as a first step, earlier this year, Rachel Reeves and I set out our plans for reform of the flawed work capability assessment. We know the assessment is a cause of great anxiety among disabled people. We're determined to return it to its original purpose, as the gateway to enabling those who are able to work to receive the support they need to do so. So we've said that we'll ensure that every claimant receives a statement of how their impairment or condition impacts on their capacity for work, a statement that they can take to an employer or an employment programme provider or training provider and use as part of a discussion about the support that needs to be assembled to enable the individual to prepare for and take up work. But when employment programmes themselves are performing so poorly, clearly there's more we need to do. So my colleague Stephen Timms and I have also been thinking very carefully about how we remodel employment support so that programmes are effective in helping disabled people to fulfil their ambition to work. We know the top-down, centrally driven work programme hasn't delivered the support disabled people we need. And that's why, earlier this week, Stephen confirmed that Labour intends to replace the work programme by contracting employment support at combined local authority or LEP or city region level, and to introduce a new specialist disability employment programme to support those who are further away from work, bringing together resources from work choice and the work programme, and by asking combined authorities to look at how they can use their resources and the resources available locally to help achieve this ambition. This isn't about spending more money, but about making better use of the resources that are already being spent to so little effect. And in drawing up our ideas, we've listened very carefully to what disabled people and disability charities have told us. We've looked closely at the recommendations of the Massey Task Force and at the ideas coming from local authorities and from think tanks, particularly in its recent Condition of Britain report, the IPPR. All agree that more local contracting will produce more effective, tailored models of support for disabled people. And all agree that employment programmes for disabled people are in a muddle, with no clear gateway to employment support, no clear rationale for why someone would be referred to which of the existing programmes, work choice or the work programme. We intend to introduce real clarity about what programmes are on offer and what they're intended to do. And today I'd like to say a little more about how we intend to do that. Under Labour, our aim is that the reformed work capability assessment will be followed up by a Job Centre Plus assessment for all those placed in the work-related activity group, undertaken by a specialist disability employment advisor. Following that assessment, the DEA would allocate a client to one of two forms of specialist work support. We'll offer tailored work-focused support as part of the replacement for the work programme to those who are expected to be able to return to work fairly quickly. And for those in the work-related activity group who are not expected to be able to return to work within the short term, we'll commission a new dedicated programme of health-focused support for those further from the labour market. This two-tier model of specialist support for disabled people in the work-related activity group will enable us to offer more expert, more tailored programmes with a clear role for disabled people themselves in helping to shape the support they receive. Our approach will recognise the different needs of those who face the greatest barriers to employment and ensure that providers are rewarded appropriately to avoid the creaming and parking that we've seen in the work programme. Now, of course, it will depend heavily on the skills and expertise of the disability employment advisor to get people to the right form of support. We recognise the value of the DEA role, and while we need to consider our plans within the context of existing capacity and resource constraints within Job Centre Plus, we're determined to have the right resource behind this function, including retraining existing staff where necessary. And by commissioning the support at combined local authority level, we'll be able to draw on the expertise and resource of local authorities, their knowledge of the local economy, their relationship with local employers, and with specialist and local providers who've been unable up till now to make the work programme work effectively, as highlighted by the Massey Task Force. We're really excited by the possibilities behind this approach. Stephen talked earlier this week of the potential for different agencies, the NHS, training providers and colleges, employers, the local authorities, housing, Job Centre Plus, charities and specialist agencies to work together to provide individualised employment support to those with the greatest barriers to employment and to deliver the real improvement in employment outcomes for disabled people that the work programmes failed to deliver. Now, of course, the Labour government would want to consult widely on this plan, including with disabled people themselves, in order to get the details right. But we also recognise that reforming the work programme alone will not be enough. Many people have also told us that there's a real need to reinvigorate access to work. Even government ministers have proclaimed it's government's best kept secret. A secret they seem to be doing their best to keep. I hear repeated reports of bureaucratic obstacles to claiming access to work support, rigid interpretation of what support can be offered, and a huge lack of awareness among employers of the support that could be available to enable them to take on a disabled employee. We think this is a nonsense. We want to get access to work back on track. A Labour government will be proactive in promoting access to work and will tackle the obstacles to its effective operation. We'll appoint a disabled people's-led group to advise us on the scheme and how it needs to be improved. What I've set out today represents a medium-term plan for reform, and as I've said, we will want to consult widely. The system of support for disabled people to work is frankly a mess, and it will take time for us to sort out. But we know that there's a fund of expertise and goodwill, including among disability charities, in local authorities, among providers and within Job Centre Plus, that we can draw upon. And we firmly believe that by developing new tailor-made programmes of employment support for disabled people, commissioned to take account of the local economy and local labour markets, by ensuring that the new work capability assessment includes a statement of how someone's health condition affects their ability to work, which could be shared with employment providers, by enhancing training on disability issues within Job Centre Plus, with a view to ensuring that more advisors can take on the role of disability employment advisor, and by protecting the role of disability employment advisors and ensuring that they play a role in publicising access to work, that we can make the resources in the system work much more effectively to achieve disabled people's own ambitions to fulfil their own potential at work as the next step in the journey to achieve equality for disabled people. That's the priority of a Labour government, and I look forward to working with you to make our ambition a reality.